So what this user is saying about the black box warning for pitocin is actually true, and here it is. Oxytocin injection synthetic is indicated for the medical rather than the elective induction of labor, meaning you have a medical indication for induction rather than it's elective. Available data and info are inadequate to define the benefits to risk considerations in the use of the drug product for elective induction. Elective induction of labor is defined as the initiation of labor for convenience in an individual with term pregnancy who is free of medical indications. It's important to note that this black box warning for pitocin and elective induction of labor came out in 2003, 20 years ago, and we have a lot more information on the use of pitocin for induction of labor since then. It's also important to note that there are several medications that we use in pregnancy that also have black box warnings. Here are some examples. Antidepressants or SSRIs like Zoloft, Prozac, Paxil, antipsychotic agents like Seroquel and Zyprexa, opioids like hydrocodone and fentanyl, and also metformin, which we use to treat diabetes. In a study looking at black box warnings that have serious adverse events, which this one for pitocin does not, it showed that less than 1% of patients who received a drug in violation of a black box warning experienced serious adverse effects as a result of taking the drug. So we know that's the case. However, pitocin does not have a black box warning because of a serious adverse event or potential of. It has it because of, back then, the lack of data for pitocin and its use for elective induction of labor. Big difference. And one of the problems with black box warnings is that while they are intended to warn the public about potential risks or effects of a drug, it may discourage people from taking drugs that actually may benefit them. So a medication with a black box warning can still be a viable option when used appropriately and in the right population. A black box warning is not meant to completely rule out the use of that medication. It's simply meant to bring out important information on a medication, like in 2003, there was enough information on the use of pitocin for elective induction of labor, only for induction of labor for medical indications. Now, in the caption on that video, the user said, normal labor contraction pattern is every 4 to 5 minutes, but hospitals want you to have contractions every 2 to 3 minutes. There's actually more than one way to define a normal labor contraction pattern. An adequate contraction pattern can be defined as a total of 200 Montevideo units in 10 minutes. A normal labor contraction pattern can be 3 to 5 contractions in 10 minutes, with each contraction lasting 30 to 40 seconds. Or it could be contractions in the active phase of labor, 6 centimeters or more, no more frequently than 5 every 10 minutes, with each contraction lasting no longer than 90 seconds, with at least 1 minute of rest in between each contraction. And this is why it's better to give context, clarification, and education rather than sensationalizing things.